Members of the media, let me welcome you here to a very important statement and this press conference that we are about to make here this morning. And also, let me welcome our comrades who are maintaining the protocol of social distancing. A few comrades representing T&TEC. That's the union officers representing the workers at T&TEC, because we are going to be dealing with a T&TEC issue here this morning specifically. And also, let me welcome, joining us here this morning is the president of the Seamen and Waterfront Workers Trade Union and also the general secretary of the National Trade Union Center, here present here with us this morning, Comrade Michael Aniset. And we also have online in this meeting the president of the Federation of Independent and Trade Unions and NGOs, president of Phyton, Comrade Joseph Remy, also. And sitting on my left, your right, is Sister Riza from the executive of the union, OWTU, executive vice president, representing the T&TEC comrades here this morning in this issue. I want to say first of all that this issue is of such high importance, which is why Comrade Michael Aniset, representing NATOC, and Comrade Joseph Remy, representing Phyton, are also in on this meeting. Of course, supporting, but more importantly, paying specific and particular attention to the issue of T&TEC and its approach to its workers, but even wider than that, its approach to the national community. Now, the OWTU, we would have attempted to, over a period of over the last year or so, since this COVID-19 situation, since this pandemic situation, attempted to, on the one hand, in an amicable way, discuss with the Commission, keep the operations going without any recourse to disruption or major disruption or so, and that wherever and whenever there were disruptions, we approach it, that's our members, the workers, the T&TEC workers, approach it in a manner that was so seamless that the country didn't feel any negative fallout. In other words, those workers over the last year throughout the pandemic would have placed their lives and the lives of their families at risk to ensure a commodity. Without that commodity, we would not have been able to even be here today. Because that commodity, the commodity of electricity, would have allowed for and successfully allowed nursing homes, hospitals, emergency centers, and also which would have provided for workers and the general population who was asked and who is still asked to stay at home. So imagine yourself home without electricity, what that would be. Without you having the benefit of turning on the various switches and getting a reliable supply of electricity. Imagine the nursing homes. With all of these cases, the nursing homes and the centers who have to do what? Provide the same vaccine for the population. Imagine them without electricity. Imagine how you're going to store your vaccines and so on, which is supposed to be in cold storage. Imagine how you could do that without electricity. And when you imagine all of that, and you get the full picture, then I want you to imagine, as a country, as a population, those who provide that service. And sometimes we take for granted the service that is provided by those of whom put their lives at risk, and we just pay very little attention to that. But that is a normal course of how people operate. But you would expect differently from those who are charged with the responsibility to ensure this service by employing the workers under certain terms, conditions, guidelines, safety procedures, and so on. You would believe that those people are responsible enough to ensure that everything that ought to be put in place is well put in place to make sure that the country gets the benefit without recourse to putting those lives in danger. And so we would have, as a union, the OWTU, would have been behind the scenes, consistently, repeatedly, raising issues and attempting to, in an amicable way, get the commission, its top senior management, to do what is necessary. And it was a hell of a lot of doing to ensure that that occurred. But it seems that where people have their own agenda, and for whatever reason, and I'm not now this morning going to venture into what reasons, although I could do that, but that they feel they are mightier than God. They feel that they themselves are not responsible or accountable to no one. That's the management of T&TEC I'm talking about. That by their reckless approach, they put the lives of those who provide this service. And I went at length so that people would appreciate, because sometimes we take for granted when we turn on the switch, you get lights. You turn on the air condition, you feel cool. You put on your TV, you get Netflix. And all of that, you take that for granted. But that couldn't come without the input of those of whom sometimes we take for granted. So I took my time for you to understand the magnitude of what we are dealing with. And therefore, I am saying this morning that the Commission itself, through their reckless behavior, through their irresponsible behavior, at various points in time, was placing those workers at risk. And it took the union to point out to, and to threaten in some cases, the public don't know that, to threaten certain action to get them to do the right thing. Could you imagine that? And any responsible management need not to be threatened to do the right thing to ensure the safety of the workers and the public. Because when if the management is allowed to get away with that approach, which I'm going to make the point here this morning and illustrate to you in a cogent way, that if they're allowed to get away with that approach, the lives of not only the workers, but the lives of the public is also at risk. And so there were many meetings held with the Commission, an agreement reached as to how can we continue to have a reliable service, but at the same time ensure the protection of those who provide it. And there were a number of procedures agreed to. And one of the main procedures was the issue of rotation. Because to be able to provide continuity of service, you do not want a situation where if you have an outbreak in T&TEC, like we had, and I'd come to that in a while, like we had on more than one occasion, that you do not want to have to remove from that service, from that operation, all of the workers, because everybody now affected, or everybody who are connected in some way or the other have to go into isolation. So we said, listen, let us put the operations into rotation. And so for X period of time, you would have some workers at work and some of them at home, and vice versa. And therefore, if you have any situation that may arise where anybody might unfortunately be impacted, be affected, you would not be affecting your whole workforce. But even more than that, you would not be involving to the extent that you practically can. You will not be involved in commingling and congregation and so on. And so you will be, while you are performing that task, you will be in sync with the Ministry of Health guideline. The guideline that every week the Prime Minister comes out and says that he don't want commingling, that they don't want major gatherings and so on, and congregating, and that we should, as much as possible, try to what? Flatten the curve. And everybody should do its part to ensure that nationally, as a country, we are safeguarded. But it seems that T&TEC management are excluded from doing its part to ensure that the country is also safe. It seems that the rogue element in the T&TEC management is that do what you want, how you please, when you please. But in this instant, it has the element of serious risk of not just accidents, it's death we are talking about. And with this new variant in place, there's absolutely no way that we could take any chances at all, but T&TEC taking chances with the lives of the workers and the public. That's the point we want to make. General Manager Ramsuk taking chances with the lives of the workers and the public. Human Resource Manager taking lives, they will be taking lives, taking chances with the lives of the public and the workers. So you have one Mrs. Cheeseman, don't care a damn about the workers and the public. You have one Kelvin Ramsuk, don't care a damn about the workers and the public. And they are not the ones that respond to the emergency calls. They are not the ones that drive the trucks all over the country. And you would see and even experience yourself in instances where that occurred. When you call to make a report, in no time, cameras respond. But I want to tell you here this morning and tell the country that those responding by the workers of T&TEC, if we go ahead, or the management is allowed to go ahead with what they are planning, or what they are implementing, we could face some problems in this country with respect to the spread of not just COVID, but this new Delta variant. So here's what. The Commission called out all the workers. While we were on rotation, and we were having some success with that approach, they have decided that unilaterally, that in spite of what the Prime Minister said, in spite of what Minister of Health, that fella D.L. Singh said, in spite of what the numbers are, they call out all the workers. And it's not to say that there were problems in collecting revenue. We cooperated with them. They are seamlessly collecting all of their revenue. It's not to say that they are not getting their operations successfully carried out. It's not to say that in this mode of operation with the rotation that they are not responding to emergency calls. All of their operation is being conducted, but in a more safe and responsible manner. That is the agreement that the union had with the corporation to ensure that that occurs. But somebody want to provoke the union. Somebody want to stir confusion and bacchanal and problems in the country. Somebody don't want the numbers, somebody at T&TEC don't want those numbers to go down. And by what they do, they put you, members of the public, at risk, and also the workers. Point cannot be overemphasized. So, T&TEC itself could be a major spreading medium to be infected, the workers here, and then carry that COVID positive, because you could be asymptomatic, to another place, because we're all over the country. And they are to respond to what? To your homes, to come into your homes, to come in your yard. So you could have a situation where the workers could either be going to a COVID environment, or going to a COVID environment and taking it to another environment because of this type of everybody out approach. Now, what are we supposed to do? Are we supposed to say that we're not going to, if we want to know, you make an emergency call, we are responding. Whether that emergency call is at hospital, whatever institution, government institution, or private institution or homes, what are we supposed to say? You show me your tested negative before we enter your yard. And that if you don't show me that you're tested negative, we're not going to respond. Or what are those who make the call? They are supposed to request that the comrades who come show them that they are negative. And at the end of it all, we can very well end up with a situation where everybody out and everybody now have to be on quarantine. And I want to put the country on notice that when such a situation occurs, in the context of what they are doing, that's the management, that's Ramsuk and Cheeseman and they, what they are doing to the workers and to the country, when that occurs, we cannot guarantee a reliable supply of service. Because if half the workers or all the workers tested positive, or if a majority of them are tested positive, and the rest of them in quarantine, well then who will be there to do the work? I wanted to look at some figures to illustrate the point that I'm making here this morning. That while we would have sat for long hours and came to a particular agreement with the Commission as to the particular type of approach, we would have put in place the rotation element. And that rotation element would have been successful to a certain degree. And so, we first of all want to go to this slide, yes. And this is the national figures that we are dealing with here. This slide is meant to illustrate the spike. And the spike, the time from May, June, and July. That's the national figures. And that would have driven us to put in place the type of rotation. Let's go to the other slide. Just to further illustrate the point. So you have, in May, looking at the total active cases, total daily cases, total active cases in May, and the total deaths. And you would see an increase from May. And then you will also see corresponding an increase in deaths. That has not been reduced. So the same thing that caused us to go into rotation and to take certain measures that we agreed to with the T&TEC management has not been reversed. It's still happening. But the T&TEC management, in spite of the fact that it is still happening, in spite of the fact that the Prime Minister and the Minister of Health and all of those people are saying, let us be cautious, they are taking it upon themselves to add to even spiking that up more by the approach that they are taking, by using T&TEC's operation to be a super spreading medium. And let me tell you, we want to go now to T&TEC specific. Because T&TEC workers like everybody else are also impacted. In fact, we have a number of our comrades at T&TEC who contracted, while at work, who contracted the Corona-19 virus. So you look at the pre-rotation. You're looking at in April, and we see where we have positive cases, 28, and the number in quarantine, 38. And then we go to overall, we look at still in pre-rotation, look at that chart there, 33 positive and 112 in quarantine. So those are workers in T&TEC impacted by this exposure and who would have caught the coronavirus. But that goes deeper than that, because one worker comes from a family, and that family is situated in a community. And so, as the numbers go up in T&TEC, and that those workers belonging to those communities and so on, therein lies the threat. Therein lies the opportunity to spread even more. It looks like some people really don't want this thing to end in Trinidad and Tobago. Once they are not affected, because Ramsuk is not affected, she's not affected, but there with their agenda, once that is carried out, to hell with what happened with the rest of the country. And therefore, look at doing the rotation now. 11, and that's 11 with COVID, and as a result, 18 in quarantine. And that is because of the measures that we put in place. So if there's any takeaway you should take away from this morning, is that the unions cooperating hand with the management, the T&TEC management, had us realize a reduction in the numbers at T&TEC. And of course that would impact elsewhere. But that with the situation still existing, go back to the other slide, as it is there, the T&TEC management has called out all of the workers. Let's make what progress we made, let's reverse that. And we are saying this morning, it is the irresponsible behavior, the reckless behavior on the part of the T&TEC management that is about to lengthen this, our problem here in the country with respect to contracting COVID. And that it is at the most dangerous time, because we are now at the point where Delta, the variant, has hit our shores. And if that is allowed to spread throughout the country, no amount of doing will be able to reverse the lives that would have been lost and those who would have contracted it. And let me tell you, there's what is described now as the breakthrough cases. So even though you are vaccinated, there's still the possibility of contracting COVID. And that is happening in countries where they have the best vaccine. So you have Pfizer, the best vaccine, but everybody frightened and taking precautions because there are breakthrough cases. What you have here is not the best vaccine. You have what they give you, what the government was able to scramble and provide, beg for and provide, and all kinds of nefarious things that go along with that. But my point here is that there are existing what is called breakthrough cases, and that the vaccine, as effective as it is, does not protect you from getting the virus. But that the most effective vaccine, I want to reiterate the point, on the planet is still contracting COVID. And if it is that they are with the, perhaps, the not 100% vaccine that they have afforded the citizens, and of course the T&TEC workers also, if it is that it is the intention of the Commission to go down that road, what in fact we could have in this country, we'll find ourselves in a place that plenty of people wouldn't know how we get there, but more importantly and even worse, they would not be able to get out of it. We are warning the population, we are warning the country that the reckless behavior of people in the senior management at T&TEC could cause a spike in Trinidad and Tobago. I'm also calling on the Minister of Public Utilities to do your work and not just try to reduce the workforce in the utilities. Reduce workforce because he feels his work is to send workers home, to take away the job of workers. Cut down on the amount of workers in WASA, cut down on the amount of workers in T&TEC, cut down on the amount of workers under all the utilities that come under his care, and boast about it. But your job is to intervene and to pull back this rogue element of the T&TEC management. That is part of your job. Because what is about to happen here is a contravention, is against the general instruction that the country has with respect to trying to beat back and to flatten this curve and so on, and to reduce the numbers. So do your job, Minister of Public Utilities, and pay attention to what is happening in T&TEC in a real way. And don't let Ramsuk set you up. Don't let Cheeseman set you up. Do your job. Do your job, Minister of Labour. Minister of cannot be found, cannot be heard. Do your job. Because all of these ministers, they are charged with a particular responsibility. And were it not for unions, the trade unions, everybody will be scrambling for themselves and everybody will be in strange places. So Minister of Labour knows what is happening, don't know how to intervene. Minister of Public Utilities, same thing. The only discussion that he would have with general manager of T&TEC is how to cut down and who to send home and that kind of, how to make the place safe. Those discussions are not happening because the result, we are experiencing it. And again, I want to say to everybody here this morning that as we speak, there are a number of employees at T&TEC who are infected by this COVID-19, this coronavirus. But that right now, everybody, all countries are doing what is necessary and possible to ensure that the Delta variant do not sweep their countries in terms of infections and so on. And that is about to happen, but even worse will be contributed to by the recklessness of this T&TEC management. If you book a flight with an airline, you expect that that airline has your safety, your lives is paramount, and that they will do all that is necessary. So you would expect that. You pay for electricity, you would expect that the commission, as a responsible entity, will ensure that you get this commodity, this reliable supply, in a safe and responsible manner. That is not happening. Yeah? And so we want to pause to allow for any questions coming from you members of the media, because what we stated here this morning are facts with respect to the numbers. Well, the workers have been called out. All the workers have been called out. There was a meeting last week with the union, consistent with the approach that we would review the situation, and on the basis of the review and on the basis of all the things that they committed to do, which has to do with risk assessment and so on, having done those things, we'll then now look at a phased-in approach. Now, you see, we are not opposed to having all the workers come back out to work. And let me just make that point. The union is not opposed to having all the workers come back out to work, but it must be done in a safe, secure, and responsible manner. And it must be consistent with guidelines of the Ministry of Health, and also it must be consistent with the agreements that we made, the reality and T&TEC. Because if the reality is that the measures that we put in place bore fruits, why would you want to go against that now?
What is the management response to why they want all the workers back out?
Well, they just don't care. They want all the workers back out. And that is what concerns us. And there's no real justification, because remember I made the point that the country has not experienced a disruption in service as a result of the rotation. But what T&TEC benefited from, and as a consequence the country benefited from, is the reduction in the numbers through that approach. And therefore any reduction in T&TEC will be a corresponding reduction in the country's numbers. That is what they benefited from. So they alone and their agenda knows why they want to go down that road.
So basically what you're saying is the nature of the T&TEC workers' job in terms of having to go to different locations based on how out it is. And that if you have everyone working, they can go somewhere, pick up the virus, bring it back to wherever you are there is, and people disperse on to different areas. So it's more about the nature of their job as well that makes them even higher risk.
That's right. And the more of those workers out, is the more higher that risk is. And that risk, and we understand that some jobs carry an inherent risk and so on because of the nature of the job and where that job is performed. But that does not require us to do that recklessly. That's the point that we're making.
Wasn't there some issues last year as well?
Which is why we had was to, I'm glad you remember that, which is why we had was to come out and demand that certain things put in place. But we had crossed all of that, crossed that bridge, and we are at a point where, yes, they at no time relented, but we were able to show through the objectivity of the union's position and the benefits of it and get them to agree. But somebody think that things are going too smooth.
Clearly it seems that the dialogue is not working.
Yeah.
Right? That you have had agreements, you've been doing this for the past how many months.
Yeah.
It's not working. You're admitting that what the management is doing is a contravention of the health regulations and all of that. They're going against the directive, the wishes of the people who are in charge.
Yes.
Right?
The government.
Is there perhaps a legal recourse that the union can adopt? Because clearly the dialogue doesn't seem to be
Yeah.
to ensure that, that they abide by the rules and regulations.
Yeah, certainly. And that will be pursued, but immediately we want to warn the public, because while that is happening, public place at risk.
Yeah.
So that has been done, but immediately we feel that the public should be told that T&TEC's reckless and irresponsible behavior is putting both the workers and the public at risk.
So what do we do if I have a problem at my home, which I had some time ago?
Yes.
They responded immediately and efficiently,
Yes.
right, and corrected my issue. What do we do in a case like that if you have that fear factor?
And that is where,
What do you do?
and that is,
Stay in the darkness?
right, and that is where, right. Well, that's the choice. You're choosing between staying in the darkness or with the light, and with the light of COVID, the possibility. Yeah? And that is why we are saying that let us, first of all, inform you, members of the public. And when you say T&TEC respond, I just want to take it down a little more granular, because sometimes when we say T&TEC, we feel it's the truck respond or it's T&TEC itself. See, workers, people like you who respond. That's like how you just respond nicely and cover these stories. You see, workers who responded are responding. And those workers could be what? They could say, well, we don't know in the darkness who are COVID or who don't have COVID. We are going there. You remain in darkness. Or you could say, don't come, because we ain't sure who coming. And it's a chaotic situation. But the risk ought to be managed, which is why we have risk assessments. And therefore, in managing that risk, we are saying that, listen, you don't want a situation, if for some reason vaccinated your whole household or not, that there's this breakthrough. You don't want those comrades going back to their yard, back to their families, and so on. So, and being a super spreader, because there's more numbers involved.
You said the workers are already been called outside, but when does the commission want to actually start having all these workers back out together?
Well, that's happened yesterday. Yesterday. So
So
we were trying to, through discussions, to have them understand the folly of that approach. But they are with a different agenda. Now, let's just go back to, if there was some benefit or some major reason, or for, like the point you made, Yvonne, that really occurred, that when you call, they couldn't come, because of their on rotation, there wasn't anybody to come, and therefore you had us to remain in darkness. Then what that meant is that you had a more than necessary disruption in your service because of the rotation. But that you yourself admitted it was efficient, they responded. And that's during the rotation. So my point to everybody this morning is that the rotation provided for a continuity of reliable service, but at the same time took the responsible approach of not opening up and putting everybody out at risk at the same time. Now, there could come a situation where everybody out across the board are affected. They're on home, they're home in quarantine, and those who are in contact with in quarantine. So then when you call now, it'll really be short-staffed because there are nobody. And maybe that is what they're pointing to get everybody in T&TEC, everybody in T&TEC, the employees now, the substantive employees affected, and then bring out their contractor friends. That's perhaps where they want to go. But that is not, we have a serious problem with that. And that is why we are saying, and we could say who are the contractors' friends, but that is not for this morning. Who on the top management are friends with the contractors and so on. But that's still another time.
So are the workers going out and, are they going to continue to go out, or there's going to be some resistance, some in terms of actually physically going to their workstation?
Well, we are, first of all, through this medium, and also by writing to the Minister of Health, because he is illustrating to the country that there should be certain guidelines should be followed, and we want to point out to all of them that T&TEC is not excluded from those guidelines. Yeah, that's the first step. And as I said, as we go forward, we cannot guarantee what will happen next, except to say that everybody, regardless of whether it's a essential service or not, everybody is entitled to protect his or her own life. Your life comes first. Yeah?
Mr. You're saying you are going to write the Minister of Health, is that this week?
Yes, because we met this earlier this week, and we prevailed upon them the point that we are making here this morning, and that it is not wise to take that approach, and that they are hell-bent on going down a particular irresponsible road. And therefore, this must be drawn to the attention of the Minister of Health and, of course, the Minister of Public Utilities. And when you meet with the Prime Minister at those press conferences, it will be good to inquire if T&TEC is excluded from all of those guidelines. If T&TEC is above and beyond the law. If T&TEC is not required to ensure that it employees. And if he says yes, well, then we really would be in a strange place. Yeah. I doubt it, based on what we are hearing. Yes?
I think you mentioned that some T&TEC because got the virus. Was there a lapse in protocols at T&TEC that caused this, or was it negligence on behalf of the worker? Because I've heard others who say they got the virus at work, but you can't really prove that somebody actually got it at work, because the virus they could get anywhere. So was there a lapse that?
Yeah, but if I'm at work and I'm exposed to my colleague who is tested positive, well, where I get that from? I get that from work.
Would the reason I'm saying that is because, listening to the stories around, you realize that a lot of people lie about their status. People will come out and walk around. They know that they could be positive, but they still come around walk and they say that they're not.
No, that's not our case here. Our case here.
So I was wondering if there was some lapse.
Yeah.
T&TEC or something that.
This is what the press conference is. Not just a lapse; it's a purposeful, intentional lapse on the part of the management. Because if you have a situation where you have more people congregate, well, you accept that, right? More people congregate, the possibility of spread is greater, and you bring out all of the workers. And in your space where workers are working where half the workforce would have been off, but I now can social distance and so on because of my various workstations. But I put back everybody in one space. That will be placing people at risk. Yeah? And therefore, we are saying that it is reckless and irresponsible on the part of those who are in charge to want to do that. Yeah?
In terms of vaccination, has that been going on within T&TEC and in all because
Yes, that process is going on. It's just like in any other place, but it's taking place in T&TEC too. But as I said, the vaccine is not by admittance of those who create the vaccine. is not 100% effective in stopping COVID, right? And you're having breakthrough cases. Well, let's just dress back a bit and understand what is happening in sweet T&T. In sweet T&T, the vaccine you're getting, there's a lot of questions with that vaccine, not the least being the issue of the effectiveness of it. But that the most effective vaccine on the planet, the makers of those vaccines and the people who took those vaccines and the government is admitting that they want to have what they call now booster shot and so on, booster jab and so on, because this Delta variant is breaking through even that. Yeah? So if you have the big, strong vaccine, it can't protect you, and then you have the Sinopharm, at least even more ineffective. And then you know what happened here. And in a situation like all of the above, you're putting my comrades at risk, and we have a problem with that. Yeah? So,
at one point, there are over 130 people in quarantine. Do you have an idea as to how many vaccinated and what's the workforce like you're talking about?
the what workforce? T&TEC workforce?
Yeah.
Yeah, around 2,800 workers.
How many
Approximately.
vaccinated? Do you all have an
Yeah.
idea?
No. But we know that the process is continuing, and we also know that, well, the point I was making about that there's this fear that vaccine or not, we could be exposed in. And let me just say too, that children, we're now hearing where children, yeah? Children are also getting the virus. Yeah? So,
Are you saying that the workforce in T&TEC are exhibiting vaccine hesitancy as far as...
no, I didn't say that. No, I didn't say that. Where do you hear that? I didn't say that. Ooh.
No, I'm asking.
No. I didn't say that. So,
You're talking about the
no, you asked if am I saying it, but I didn't say it. Now, if you ask it differently, you know, I say I am. I say I didn't say it.
Because you're talking about the efficacy of the vaccine.
Yeah.
And then we also know that, of course, the scientists are not saying you can't get COVID, but it will avoid you from reaching into the
Yeah.
hospital and at the ICU level. So you're kind of shunning away from that. So I was asking you, have you heard from the workers that many of them don't want to take the
No, I've not heard that many of them don't want to take the vaccine, but it's just like in the wider country that people have concerns about the particular vaccines that are being offered. And by the way, do you remember, there was a time, and perhaps, I don't know, perhaps they all know at this time, that they do not have enough vaccines for the entire country. That too is an issue. All of those things are in the mix. But that too is the right, as I would demand a safe environment to work, that too is the right of the worker to, and any person, to accept or not accept vaccine. But I have not heard that in T&TEC. Huh?
Can you say what is the current number of workers who are positive at this moment and how many in quarantine?
How many what?
How many workers are positive, who are tested positive at this
Do you have
point
your
in
number?
time? And how many
Yeah.
are in quarantine?
Yeah, just, yeah.
Oh, that was the figure.
Yes.
Rotation 11 and is something else?
Yeah. What's the number? Is your numbers? And that would have been as of last week.
And that April 16th, that was the first rotation, right?
That was, yeah. Remember we had a situation where they were not listening. We discussed. Then you went into rotation and so on, and then you went back into normal mode. And then you went, and then there was this major activity in May, and then you had all this spike and so on. And then we put rotation in place, and during rotation we got the benefit. This is the point we're making.
Is that a fair amount of business frustrations at the last year before you had a sort of a TV scale as well?
You had a what?
TV scale.
Oh yes, that's true.
I mean, so does that
Yes, that's true. And the variant, the associated problems and imminent risk with the variant, and that's why people have to be more careful and more cautious and so on. But the TB scare, is the same type of approach with the management, kind of lackluster approach to treating with issues with respect to their workers. And not until people are held accountable in top management for the reckless behavior, we'll continue to have this. And takes only the union to have to respond and to take action. Which action now, this morning, I'm not at liberty to say, but to take action for the preservation of the lives of those whom we represent.
Have there been any COVID deaths at TNTEC?
Yes, it's two. Two? Yeah.
Where remind me?
The area? Yeah, just give us the area. I'm advised that it's in the port of Spain.
Yeah, I think
Remember that? Yes. So it's real. It's real. T&TEC is not insulated from the coronavirus. It's not. It's real. But that T&TEC, if we are not careful, could be used as a super spreading medium if we go along with that approach. That's the takeaway we want to mention here this morning.
Out of these numbers, any deaths related?
Did I say?
Oh, sorry, all
Yeah. It's okay. Yeah. Right. Anything else? Yeah. Well, we call on General Manager Ramsuk to do the right thing. We call on Jacqueline Cheeseman of T&TEC Management to do the right thing. We call on the Minister of Public Utility to do his job and instruct them to do the right thing. We call on the Minister of Labor, who is responsible for the USH agency and authority, to ensure that that agency and authority does the right thing for the protection of lives of the workers and also for the protection of lives of the public. Yeah? So you want to look at pre-rotation and during rotation. And you also want to attach to that there continues to be a reliable service, because this is what underpins that. There is no case to be made that rotation is causing a disruption in the service. Yeah? So they cannot come and tell you that because of the rotation you couldn't get electricity or we couldn't collect money. They can't tell you that, because that is not the case. What is the case is that they benefited. What is strange is that we cannot understand, while, go back to the slide, the national slide, while the situation has not improved, they want to bring everybody out and show chaos to the population. Thank you very much. Yeah? Anything else? That's all right. Oh, this one? Yeah. All right.